Confused about which lens to choose in cataract surgery? Monofocal, trifocal, multifocal, EDOF. So many names, so many confusions. Every doctor seems to suggest something different, and every internet search brings you to a new confusion. Don't worry, this video will end all your confusion. We'll break down each lens type clearly one by one, starting with the most commonly used, the monofocal IOL. But first, let's be honest. No artificial lens is perfect. Your eye's natural lens, the ones with which you are born with, is the best. Still, human science has came a long way. Today's intraocular lens can give you the vision that's remarkably close to what nature intended. See, I will give you the basic idea of the lenses. Basically, if you are going to purchase a car, you have so many options. But if you see the fuel, you have majorly three options: diesel, electric, petrol. Further, there are subcategories like the type of car, like sedan, SUV, hatchback, which company you go for, which color do you want, which power of engine do you want. The concept of lenses are just the same. There are three basic categories in intraocular lenses. First, the monofocal. Second, the multifocal. Third, the EDOF lenses. And fourth, which is not actually a category, it's an add-on feature to all three of these lenses, which is called the toric lens. So a monofocal lens can be a monofocal or monofocal plus toric. A multifocal lens can be multifocal only and multifocal plus toric. And an EDOF lens can be just EDOF and EDOF plus toric. So basically there are six types of lenses available. There are newer lenses like light adaptive lenses, but they are still not used in India, so I won't like to cover it. So there are many new lenses entering the market from different countries, and they are performing very well. But many of them do not yet have a strong public clinical studies, so I am not covering them in this video. But that doesn't mean they are bad. It just means that more research is needed for these lenses. The lenses mentioned here are just examples and not are the only best lenses. Every patient is unique. The best lens for you depends on your eye health, your lifestyle needs, your retina and cornea conditions, and even your profession. That's why it's so important to discuss these options with your eye surgeon before the surgery. So let's start with addressing the lion in the house, the monofocal intraocular lens. Mono means one, so this lenses provide a focus at a single point, and that's for the far distance. These are the most commonly used lenses in clinical practice. They are perfect for driving, watching TV, seeing far objects. So with the monofocal lens, you will need glasses for near and intermediate tasks like reading, studying, working on the laptop, using your phone, etc. And most people are comfortable with these lenses, as after 40 years of age, many people already have reading glasses. So they are adapted to reading glasses. And so majority of people in our country opt for these monofocal IOLs. So the advantages are that you get a clear-cut far vision. With these lenses, you have very less decreased contrast sensitivity, and you have very less halos and glare. Now, what are these contrast sensitivity, halos and glare? That I'll discuss when I discuss the further lenses which are available. Also, they are covered by insurance in most cases, and they have a strong proven safety record for stability. So some of the examples of these lenses which are studied usually are Technis and Technis Enhance by Johnson & Johnson, Acris of IQ by Alcon, and Indian companies like Biotech Vision Care has iCril Plus and Optiflex Genesis. Again, I don't have any financial interest in making this video. All these lenses are just an example which are being widely studied. Newer manufacturers like Rayner and Hoya, whose lenses provide excellent results. So you can blindly go for the lenses which are suggested by your eye surgeon. In the next video, I'll discuss about more IOL options.